Hi, I'm Eric Knowles, the president of the Miami-Dade Chamber of Commerce, and welcome to the Member Connection. But before we get started, a word from one of our supporters. Hi, and welcome back to the Miami-Dade Chamber of Commerce Member Connection. Yeah, I'm the guy that's excited about our next guest. It is amazing. This is March, and it is Women's History Month, and I've been bringing some history makers on for this month, and we have an amazing individual, uh, Dr. Yvonne Johnson-Phillips. How are you?
I'm well, thank you. Thank you for having me.
Absolutely, absolutely. We were talking a little bit before, we came on the air, and you've hit some milestones in being the first on a couple fronts. I'm sure on many fronts. I'm going to back up a little bit. Harvard graduate. Uh, you are the chief medical officer at South Miami Hospital, vice president, and the first.
Well, I was the first one to assume that role at my particular hospital. So we
Okay.
had not had a chief medical officer prior. And I've been really pleased to be able to help define that role and make it work.
Talk about that role a little bit. What does it mean to be the chief medical officer?
So, as the chief medical officer, you are responsible for patient safety, for quality in the hospital, and I oversee a lot of the functioning of the physicians
Okay.
on the staff of the hospital and credentialing those physicians and re-credentialing,
Okay.
giving them, making sure that they have the uh, skill and the privileges to do the work that they do there. So
Okay.
we just ensure that patients are safe when they come to the hospital and that they receive very high quality care.
Right. You know, um, Obviously, and I'm thinking in my mind, you talk about hospitals, obviously the importance of what they are, and obviously what you do is the utmost importance, like you said, to secure the safety of the guests that come there, patients, et cetera, et cetera. From a chamber perspective, um, I deal with contractors that do work at hospitals, and I know there's this ACA certification in order to actually do work at hospitals. And we just went through a series with another organization here in South Florida that had what they call a mentor protege program, because if you're not certified as uh, through ACA, you
Mhm.
cannot work in hospitals as far as construction. Have you dwelled in any of that at all?
I don't really work so much on the facilities side and
Hmm.
with the vendors. We
Hmm.
really work with the medical staff.
Right.
So the physicians, the nurse practitioners, the physician assistants, those are the licensed practitioners that we deal with. And yes, we do a lot of mentoring within that space.
Right.
I have a mentor
Okay.
as an administrator, and uh, absolutely, that is really the way in which we provide a lot of the medical education.
Okay.
So, medical students go to school and they get the academic side of it, but then they come to the hospital and they work alongside more seasoned physicians.
Okay.
And it is very much a mentoring type of relationship where, we call that training. We call
Right.
they're in interns and residents. And at Baptist Health, we really are developing a very robust training program for physicians, for residents, through our relationship with FIU.
And I know that there's obviously, um, with COVID for the last couple of years, and we're not out of it. The pandemic, I guess, it's been lessened. But how has that been challenging, obviously, for you? And how have you, as a chief medical officer, had to deal with that?
Well, Eric, you hit the nail on the head when you use the word challenge. That is exactly how I describe it. COVID for me and the other chief medical officers in Baptist Health, and I would say throughout the country, it was a the professional challenge of a lifetime to deal with a global pandemic with a virus that was a novel virus, meaning the world had not seen it before,
Okay.
and we had to deal with a lot of issues just on the fly where we really didn't know what we were dealing with.
Right.
I have to give kudos, props, shout outs to the medical staff, the nursing staff, the technicians, and everyone who worked in the hospitals because they came to work every day and lived up to the oath that we take
Right.
to serve our community with that unknown and not knowing whether they were putting themselves at risk or actually recognizing that they were putting
Right.
themselves at risk and not knowing exactly what risk they were taking for their families. And
Right.
it
Because you
was
got to go
really
back home.
exactly. You go back home and, you don't know what you are bringing home to your family. But yet those people came to work every single day. When the country kind of shut down and we all went home and stayed home and worked from home,
Right.
those of us who worked in the hospital and healthcare
Didn't
did
have
not.
that.
They kept coming to work every single day. And that was when we really did lean on the system administrators as well. So while I'm the chief medical officer for my particular hospital, we have uh, administrative chief officers for the whole of the health system.
Right.
And that was just amazingly helpful to create policies for the 12 hospitals that make up Baptist Health instead of having 12 separate, policies that each of us were having to do. We were able to come together, create policies for the whole of the health system. We had to address things like shortages of testing, shortages of PPE, that protective equipment that we
Right.
wear. We had to address shortages sometimes of even medications that were needed. And of course, there was always that dreaded threat that we were going to face shortages of the ventilators.
Right.
Fortunately, we never did that. We were able to care for a lot of our patients without having to put them on ventilators, but we really did see a lot of illness, a lot more death than than we ever had seen before. And it exposed a lot of the health inequities in our community.
Right.
And I think that is what we're now starting to address and looking at how do we fix that.
And you brought up a point. As I say, the onion was peeled back about those inequities, not only with the death of or the murder of George Floyd, and then the pandemic happening in our community, the Black community, Black and Brown communities. Uh, that whole lack of understanding of the suffering that we have had throughout the years was, as I said, the onion was peeled back, and the health issues and that we suffered through diabetes and all
Exactly.
the high blood pressure and the things that the Black community has suffered through, and Brown community. Um, where do you see us going now in terms of, as I said, the pandemic hasn't passed us. We're still dealing with
Correct.
it. Here, excuse me, here we are at Miami-Dade College, and there's still a testing center
Yes,
outside of
I
these
saw
buildings.
that when I came in.
Right. So where are we now?
Well, we're in a much better place than we've been since the beginning of the pandemic. Here in Miami-Dade County, we have a relatively low transmission rate. We have a scale where we say we're either in the green, the yellow, or the red, low, intermediate, or high transmission. So we're in a relatively low transmission rate. But even when we were in the red a couple of months ago,
Okay.
uh, what we were finding is a lot of people were developing COVID. They were transmitting, and I'm sure you probably had friends that said, "Oh, no, I can't come. I just tested positive for COVID." And that's still happening to a smaller extent today. But very few of those patients were having to come to the hospital, were getting
Right.
so sick that they had to come to the hospital. So the variant that's out there today, while it is still somewhat contagious, is less virulent, meaning it doesn't cause significant disease for most people. Uh, some of the other variants that we were dealing with when it first came out, and then Delta, which was kind of the really super bug, um, those were the ones that revealed that they were associated with people who had chronic medical illnesses, like you mentioned, diabetes,
Right.
high blood pressure, asthma. And those people who had those conditions were much more likely to get very sick and need hospitalization
Okay.
or to even die, to
Oh, wow.
succumb from COVID. And so, what that demonstrated is that people in our community, in those Black and brown communities, were at higher risk from COVID because we were the ones who have the higher rates of poorly treated diabetes, of poorly treated or undiagnosed hypertension, of asthma, of a lot of the environmental type of
Right.
illnesses as well. And I think what we're also looking at is how much of that is just a genetic predisposition to that,
Okay.
and how much of it is actually due to living in a country where you're subjected to discrimination and the history of racist policies. So, a lot of the poverty and a lot of the issues that we see that minority communities face, you may not say you may be able to say, well, there's not as much racism today,
Right.
but a lot of how we are living is a result of a lot of the racism that was just completely overt in the past.
It's interesting that you bring it up, and I wasn't going in this direction. And obviously, there's been a lot of conversation about DEI and a lot of things that we're dealing with in our state. And um, not that I want to dive into that, but obviously these are the things that are now being pushed under to say that these things didn't happen that you're talking about.
Well, the interesting thing is, I'm aware of what's going on in the state, and I also am not trying to get directly into that. But what I will tell you is, in medicine,
Hmm.
we are being directed by our accrediting body, the Joint Commission, which accredits most of the hospitals throughout the country. We are being directed by the Centers of Medicare, Medicaid, CMS, who pays a lot of the bills, to have programs that address health equity issues.
Okay.
And we must demonstrate that we have programs that are looking at that, whether it's something in the maternal health, maternal mortality, whether we're talking about having access for the differently abled community, whether we're talking about having programs for the improved treatment of sickle cell. And, I name all of these things because these are things that we're doing at Baptist Health, where not just because we're being directed by those bodies, but because it's really the right thing to do.
Right.
But beyond knowing that it's the right thing to do, all of the hospitals across the country are being directed to address health equity issues. So however we want to agree or disagree about what the origins of those health equity issues are, we know they exist.
Right.
And in the healthcare space, we are absolutely being directed and incentivized to address
Address
them.
those. You know, that's a good point that you bring up, and we have to have a conversation off camera to address those things. And you know, we don't have a lot of time left because this has really been very informative. You are the first Black chairwoman of the amazing Orange Bowl.
I'm really very proud and honored to be the first Black woman chair.
Yes,
We have had women serve as chair and president before. We've had Black males, Black men serve in that role, but I am the first Black woman. And, you know, I think it is a result of the intentionality that Orange Bowl has made toward diversifying the organization as a whole. And I think when you bring people of all stripes, of all backgrounds and walks of life into an organization like the Orange Bowl that is as important and has the legacy and the tradition of serving this community and bringing in community leaders. Once you bring in and you have that intentionality of bringing in a variety and a diversity of our community in, then it's a very organic process to get all kinds of leaders.
right.
And I think that's really what I represent is the fact that, you know, more than 20 years ago, the leaders had the foresight to be intentional about being inclusive of all aspects of our community leaders
Absolutely.
becoming part of Orange Bowl. So
Yeah.
I'm just excited about leading this organization because we do so much for the community, for the youth of our community, building not only in sports, but also in leadership, creating facilities for the broader community. We have our legacy programs where we renovate community parks in areas
Amazing jobs.
that are under-resourced. And, you know, I'm really proud of what we've done because we can actually see the result. We have two members of our, at least two, there's probably more, but I know of at least two because one has been a past president, one will be, is our first vice chair, so he'll be a president in the future. And they both played Little League football in parks that we have just recently renovated.
Wow.
And so we can see the impact that these sports programs have
Absolutely.
in building leaders in our community.
Yeah.
And so the idea that we're able to renovate these fields and make them safer and make them more desirable for not only those Little League teams, those youth football teams, but for the whole of the community. If you go down to Moore Park here
Oh, Moore
in
Park is
Miami,
amazing.
you see people of all ages utilizing that park.
Right.
They're playing football, they're walking the track. I'm also involved with Special Olympics, and we have done work there as well and utilize those parks. So it's been really amazing.
Yeah. No, Moore Park is amazing, and what the Orange Bowl has been doing. I could bring you back on, and we could talk for a half hour or so about the Orange Bowl and everything. I mean, the Orange Bowl game, but we're out of time. And you know, this has been the Miami-Dade Chamber of Commerce Member Connection. To get in touch with the chamber, go to m-dcc.org or call the chamber at 305-751-8648. Dr. Yvonne Johnson-Phillips, thank you so much.
It's been a pleasure. Thank you for having me.
Absolutely. Today, I stand before you, a proud graduate of Miami-Dade College and the 5th president of the Miami-Dade Chamber of Commerce. I'm honored to return to the college that prepared me to become a leader in our community, providing an education second to none. So I'm asking you to please tune in every Monday at 12 noon to the Miami-Dade Chamber of Commerce's Member Connection as I interview members of the Miami-Dade Chamber of Commerce on our Facebook page at Miami-Dade Chamber of Commerce or our YouTube channel, Miami-Dade Chamber of Commerce. To learn more about the Chamber, please go to m-dcc.org or call the chamber at 305-751-8648.